Hi everyone, I'm Dr. Justin Lin here at Rehab Revive Physical Therapy, where we rehab your mind to revive your body. You probably clicked on this video because you were interested in diastasis recti. You might have had a baby recently and you've got your belly a little bit more open and exposed. It might be uncomfortable, but did you know men can also get it too? We've got 3 exercises to help make improvements, and tighten you up a little bit and decrease that discomfort. So stay tuned. But before we do, we would love for you to like our video and subscribe. Diastasis recti, diastasis recti, however you want to pronounce it, tomato, tomato.
Diastasis recti.
It doesn't matter. What we want to do is we want to make improvements. And why does this happen? There's tight fascia externally in your abdomen, your connective tissue, along with your external oblique muscles pulling things open. It's like a pair of pliers just opening things up, and that's what's going on. And then your guts and your intestines sometimes can push out, and that's the danger. And things can be uncomfortable and you can have issues there. So what we want to do is we want to find stability exercises and things to free up that fascia, and that's the exercises we're going to get to next. Stay tuned. All right, we're going to do this exercise on your back. If you're pregnant, I highly recommend you check in with your healthcare practitioner. Make sure that this is actually safe for those of you wanting to combat this during pregnancy. So we're going to get down. Okay. All right, I finally got back to my pre-COVID weight. Very excited, so I think I feel a little bit less self-conscious about this. What we want to do is first we want to do light visceral or organ massage, and you're just kind of basically, you can hold things in place. If it feels a little tight, you can windshield wipe your legs, so there's a little tightness here. You want to work on the inside. That needs to get a little bit more free. A lot of those connective tissues or fascia really tight. So we're going to follow along, and we're going to do this for about a minute or so. You can do that. You can hold it in a very tight spot, windshield wipe, or you can just hold it in place, and you want to go in that clockwise fashion. Good. And so you start small and then you work yourself bigger. So you can start small around the belly button and work yourself out like that. I'm doing it a little quickly, but that's basically what I'm doing in real time. A little bit more slowly. Good. And if you feel that things loosen, great. Your legs go a little farther. You can get into these tensions. You're also trying to improve that fascia layer as well. So good. Now, what we want to do next is, you've got oblique muscles and they go across your rib cage like this. So we want to be able to just kind of do the same windshield wiping method, and we're going to really try to peel it. I turn red a lot. You might see where I'm working. Some of you out there have the same thing, and it's okay. It'll go away. So we want to kind of work on that, really work on lengthening that. So that's why my body is going away or towards as well. My legs are going away and my hands are going towards. I can also kind of go back this way too and work on that. It's going to be the exact same thing on the opposite side. You can work into your shoulder blade. There's a lot of that stuff there. You want to free that up. You just basically hook your fingers and you're basically kneading yourself, pulling. If you get something snagged like right what I have right here, that's tight. A lot of folks, men or women, it's this rib cage, very tight, very tight. So good. Now I'm gonna go the opposite side, and so it's the exact same thing. I'm just doing it to the opposite side. I'm bringing this towards the camera right now, and so I want to pull that towards. You really want to just kind of open that up, sometimes underneath the pectoral muscles, right through there. Really get through that. You want to get that more length. Remember, things are tight. These oblique muscles can really open you up, create issues. Other issues for some of you could be reflux, hiatal hernia. Some people also have things like prolapse that are in combination with this. But usually your body, if there's a lot of abdominal pressure, it's trying to push somewhere. The path of least resistance, for those of you who have diastasis recti, it's your gut, it's your stomach. So we want to keep doing that. Yep, pretty much done with that. And the final thing, what we want to do is we want to flip onto our elbows and knees, and we want to stabilize. You want to make sure these little muscles in your spine are really big, because a lot of people are having unstable spines, and then they have to use these muscles to try to hold you together. So you want to tighten up at the right place. So you're going to be on your elbows and knees, and really I tell people you want to think of this area, you want to hold a cup of water, you don't want the water to spill. And all you're really trying to do is unweight this leg. So we're redistributing the forces into the other limbs, like your elbows and the other knee. So let's do this one since it's close to the camera. What I'm trying to do is pretend it's 100%, and then I'm slowly decreasing it 90, 80, all the way up. Doesn't look like much, but what you want to avoid is shifting your weight like a dog trying to go on the hydrant, or what you want to do is just be still like a statue, just like a statue. So right there, and it doesn't look like much, but in essence I'm trying to unweight this left knee and go up right there, and you should be able to kind of like slide a piece of paper underneath this knee without doing that, shifting weight or whatnot. So you want to hold that after you're up. Hold that till the shakiness stops. I'm exaggerating a little bit more, but in real life it doesn't look like much. Like I said, it looks like a statue. And then when you come down, that's when you're done. So you should do both sides. I'll do the other side, but what we want to do is improve that stability. And you might feel those little muscles, deeper muscles in your abdomen working, and that's good. That's what you want. And then back down. Good. So that's it.
So you can see that we need a different approach to attack it different ways, that it's not just tight muscles where it splits open your belly and your guts are hanging out. I know I personally don't have it, but it's worked clinically here, and we want to stabilize it from a multifaceted approach. Check with your healthcare practitioner, make sure these are safe for you and this is what you need. I highly recommend it. It definitely works here clinically. And we would love your feedback. If you've tried it, please leave those in the comments below. If you haven't already, subscribe to our channel. We'd love your support. Leave these likes. I'm Dr. Lin. Remember, we heal smarter, not harder.